What if your body's biological blueprint had a typo? Just a tiny error during development that resulted in a part of you, well, having a twin. That's exactly what we're talking about today with intestinal duplication, a really rare and fascinating condition that shows you just how complex our internal architecture truly is.
All right, so here's how we're going to tackle this. First, we'll get a handle on what this anomaly actually is. Then we'll dig into the 3 specific features that define a true duplication. After that, we'll look at the 2 main ways it can show up, how it can affect a person's health or not, and finally, we'll explore the absolutely brilliant surgical techniques used to fix it.
So first up, the anomaly. Let's break down what it really means for a part of your intestine to be duplicated.
Just think about that for a second. It's a pretty simple way to wrap your head around a very complex biological event. Basically, a piece of your intestine isn't flying solo. It's got a copy, a literal twin, running right alongside it.
The official term for this is a congenital condition, which just means it's something you're born with. A segment of your gastrointestinal tract, the whole tube our food travels down, gets copied, creating this extra structure that's stuck right onto the original.
But here's the thing. What actually makes it a true duplication? Well, doctors have a very strict checklist for this. It's not just any old growth. To get this diagnosis, it has to hit 3 very specific points.
And here they are. First, it's got to be physically fused to the intestine, literally sharing a wall. Second, its inner lining has to be made of the same kind of tissue as the gut. And third, and this is the real kicker, the part that changes everything about treatment, it has to share the exact same blood supply as the intestine it's attached to.
Now, this can technically happen anywhere along the digestive tract, all the way from the esophagus down. But by far the most common spot to find one of these is in the ileum. That's the last part of the small intestine, right before it joins up with the large intestine.
Okay, so it gets even more interesting, because these duplications don't all look the same. They usually show up in one of 2 main forms. Either they're connected or they're completely separate.
So on one hand, you've got the cyst type. The best way to think of this is like a closed-off bubble. Its inner channel, or lumen, is totally sealed off from the main intestine. Then you have the tubular type, and just like the name suggests, this one's a tube, and its inner channel is open to the main intestine, so things can actually flow between them.
So you're probably wondering, what does having this extra piece of plumbing actually do? Does it cause any problems? Well, the answer is, it totally depends.
Yeah, the impact varies a lot. A ton of people are completely asymptomatic. They could live their entire lives and never even know they have it. But for others, it can cause some really serious issues, like a bowel obstruction. And sometimes the duplication can have stomach tissue in it by mistake, which then produces acid and leads to ulcers and bleeding in a place that just isn't built to handle it.
And that, of course, brings us to the treatment. When these things do cause trouble, the solution is always surgery, and the approach surgeons have to take requires some serious creativity.
Remember that critical feature we talked about, the shared blood supply? Well, this is where it becomes a huge deal. Because the duplicate and the normal intestine share those blood vessels, a surgeon can't just snip out the duplicate. If they did, they'd cut off the blood supply to the healthy intestine too, which would be a disaster.
So for shorter duplications, the standard procedure is pretty straightforward. You have to remove both the duplication and the piece of normal intestine it's attached to as a single unit. Then, the surgeon performs what's called an end-to-end anastomosis, which is just a fancy way of saying they expertly stitch the 2 healthy ends of the bowel back together so everything flows perfectly.
But of course, that standard approach has a big limitation. What in the world do you do when the duplicated part is really, really long?
See, if you remove a huge section of intestine, the patient can end up with a serious condition called short bowel length. This can cause lifelong problems with malnutrition. So the goal is to fix the duplication without creating an even bigger problem down the road.
And this is where surgeons get incredibly clever. Instead of removing everything, they've got 2 main tricks up their sleeve. Option 1, they can use a surgical stapler to just divide that shared wall between the 2 tubes, basically turning them into one big functional channel. Or, Option 2, they do something called mucosal stripping. They go in and carefully remove only the inner lining of the duplication. This causes the walls to collapse on themselves and heal shut, effectively turning it off without having to remove any bowel length at all.